Good
So
luck.
true. You always.
Good morning, guys, and welcome to Unique at the Front with me, Shamla. And today I have Doctor Nicholas Maraj, and I show his face and name is familiar to you guys because he has been appearing, and I say this, he's my residential um, doctor for neuro and vascular, medical conditions. So last week, Tuesday, we celebrated World Multiple Sclerosis. I think I pronounced it, but MS Day. And today, he's going to talk all about MS. So good morning, Dr. Nicholas. How are you doing?
I'm fine, Shamla. Morning. How are you doing?
I'm fine, thank you. So it's a pleasure to have you. So let's get straight into it. What is multiple, I'm going to butcher this again, sclerosis?
No problem. Multiple sclerosis, we just call it MS, is a
Yes.
chronic autoimmune condition that affects something called the central nervous system in the body, causing communication trouble between the brain and the rest of the body. Now, we'll just take that a little bit there and we'll explain what the central nervous system is. It's basically a series of wires or nerve cells that carry signals from the brain to the muscles, causing movement. It brings signals from the sensory organs to the brain, for example, the eyes, the tongue, the skin, allowing our brain to experience the outside world. All these nerve cells or wires have a degree of insulation around them. And in MS, basically the insulation around these wires are damaged, resulting in reduced transmission of these nerve impulses, leading to trouble with walking, balance, vision, sensation, trouble with your bowel and bladder, those types of things.
Wow. So I, it is an acquired disability, right?
Yes.
Right. So you mentioned some of the symptoms, but what are other symptoms? And is it that, okay, so before experiencing those things, can you detect, okay, something is definitely happening to me that I need to see a doctor, meaning pre-symptoms?
Unfortunately, no, you don't really detect this pre-symptomatically unless somebody does an MRI for something else, maybe like headaches or something. But most of the time, people present with this disease with some acute neurological type of disturbance. For example, when the disease affects the eyes, one person might notice that they have wake up in the morning, they have a lot of blurry vision out of one eye that tends to get better over a couple of days. They might all of a sudden wake up one morning and notice trouble with their balance, have trouble with sensation on one side of the body, both sides of the body, have trouble moving half of the body or the other half, very much like a stroke. Or they may some people have symptoms that leading up to MS, but it's been very, very non-specific, and it's usually fatigue, very, very, very tired a lot of the time. Fatigue is a very non-specific thing, so everybody with fatigue shouldn't just go about thinking they have MS, because MS is as much more common as it is now, it's very uncommon generally.
So is it that the symptoms is universal or is it specific to each individual?
So different parts of the brain could be affected in one individual. So one person might have eye trouble, somebody else might have balance trouble, somebody else might have maybe like a stroke type syndrome, somebody else might have trouble with their sensation. So different people have different things, but one person can also accumulate all those things, which is unlikely, but I've seen it before, and that's very, very troublesome for that type of individual.
It just shows how complicated the brain is in terms of the wiring system. So who tends to get MS?
The really troubling thing with MS is that it hits young people by and large. So young, healthy patients in the 20 to 40 age range, it's a bit more common in women than men. Back in the past, we thought it was much more Caucasian or fair-skinned people type of disease, but that was mostly because it used to be more diagnosed in those people because they're Northern European, better access to healthcare, MRI, those types of things. But now that we have better healthcare throughout most of the regions, we've noticed that it's increased prevalence in colored people as well.
Right, and how how can persons treat MS?
Luckily, we need to make the diagnosis first. So we have a lot more neurologists in Trinidad. So most patients with MS end up going either to their general practitioner, eventually get referred to a neurology clinic, for example, in the hospital in private. Your doctor will do a physical examination, take a picture of your brain, especially an MRI, to see if there's any sort of plaques in the brain. Then from that, we can give you certain types of medication depending on the individual and whatnot. These medications tend to calm down the immune system to prevent any further damage to the insulation around nerve cells, with the intention of trying to prevent new attacks, and in some other cases with some more specific medication to try to reverse the plaques that are there.
And what about like physical therapy and stuff like that? Because obviously it's affecting your physical health as well.
Always love when you talk about the physical therapy, Shamla. Physical therapy is probably like the mainstay of treatment for patients who've had MS, particularly getting back functionality in their limbs, getting back mobility, getting back their balance.
Through your experience, and I know we going a little further, but through your experience, right? How hard it is to access a physiotherapist for your patient?
So I work in Eric Williams, and it's pretty easy to get a physiotherapy referral there. The physiotherapy waiting list isn't that long at all. The trouble with MS patients is that mobility is their issue. So to get from home to the therapy center in Eric Williams can be a bit challenging.
Yes, access, and that is a major problem for persons with disability, physical disability in general, access and transportation and stuff like that to get to and from. We have a long way to go. What advice would you give the families who have to deal with one of their family members having or acquired MS?
So luckily, we have at least one non-governmental organization in Trinidad, the Trinidad and Tobago Multiple Sclerosis Support Foundation, that provides a lot of support for patients with MS. So they can reach out to get social support, much more access to educational topics and whatnot. Other than that, talk to your treating neurologist. And MS is not the disease it was in the past. We didn't have good medications for it back in the day. Now we have a lot more medication, and we have a lot of good medication here in Trinidad. So patients are actually doing a lot better compared to patients being treated with MS 20, 30 years ago.
Awesome. And just a personal question. How, just to wrap up, when you see patients like this, right? Obviously, they go about their daily lives and stuff like that. How do you feel seeing patients, mentally not prepared to deal with these things? How do you treat a patient like that, having to diagnose them?
So it'd be a bit challenging because MS requires a multidisciplinary team, not just a neurologist, a psychiatrist to deal with a lot of the mood disorders and stuff that's come with it. I mean, MS is a devastating disease to get diagnosed with. It'll cause a lot of trouble. Most patients get some more to depression, anxiety, which is very treatable. Once the initial shock kind of wears itself off. We also have a good disciplinary team with psychiatrists, as physical medicine and rehabilitation guys, helping us out to get patients, especially young, healthy people, back into control of their lives.
Yeah. So Dr. Nicholas, I want to say thank you so much for coming and sharing, another topic, which is MS. I'm sure my audience would much appreciate it. And, raising this awareness would have is, to be aware in terms of seeking help and having hope. So thank you so much. And guys, with that being said, I want to say thank you so much for this big segment of Unique Not Different. Until next week, be good. Do good. Bye, guys. Bye. Thank you.
Hey, thanks so much as always.